We're here to respond for the support for the aftermath of Hurricane Sandy.
This is a medical shelter, and it's here because the county requested assistance from the federal government to open up the shelter. Without this site, the local shelters would not be able to take care of the patients who have medical needs, as well as the hospitals would not have a place for these patients to go.
I caught like a little bit of infection on my fingers, and the doctor just had to cut them open. I guess I'm gonna go back to work because I can't stop. I really wanna stay here and help my people in Long Beach.
The hospital is 100% functional. They operate on their own electrical grid as well as having their water supply separate from the city. We're here because they're at capacity. It's a 240-bed hospital. They're currently at 450 patients. Their ER can't move patients inside for admission because there's no place to go, so we're here to help decompress their emergency department.
The stress on all of us is dramatic, and clearly HHS assisting us in reducing some of this stress and obviating some of the requirements that would have otherwise been on the emergency services department is an important element in us weathering this storm.
Well, after a disaster happens and the medical services are interrupted, so here on Long Beach Island, what happened is that the medical center, the hospital on this island, actually lost their power, they lost some of their other support services, and the people were displaced and also had damage into their homes. So the people that maybe worked at the hospital couldn't put their full force effort into working because they were so worried about their own personal situation. When that happens, then the purpose of the disaster teams is to come in and basically set up field operations, whether it's a mobile medical unit or we actually go into the facility, the building itself, and staff that emergency room or staff that hospital. So that's what we've done. We've actually taken the place and provided the services that the hospital can no longer provide because it had such severe storm damage.